I'm one of the consultant midwives from the John Radcliffe Hospital, and I've been asked to lead an Ask the Midwife session today. So I'm just going to wait for a few people to join us. Okay, so thank you for joining us today. Like I said at the beginning, my name's Wendy Grandall and I'm one of the consultant midwives at Oxford University Hospitals. I was asked to do an Ask the Midwife session today and talk to you about, obviously, about coronavirus and answer any questions that you may have. Our plea from the hospital perspective is that people do attend their appointments that are scheduled and that you arrange with your community midwife or appointments for the hospital, because they're very important and part of your antenatal care. I appreciate some people are anxious about coming into the hospital for appointments or going to GP surgeries, etc. for appointments. But it is really important that we do some screening and assessment of you during pregnancy, and again see you afterwards with your baby as well. Obviously, for appointments, we will be asking you questions to try and work out if you have symptoms, and it's very, very important for you to be honest with that. Because we have had people turning up for scan appointments who are symptomatic, people turning up for hospital appointments that are symptomatic, and the GP appointments. Please let us know. It's really important if you have symptoms that we know about it, because if your care absolutely has to happen, we need to do an assessment of you and your baby. We can arrange to make sure that we have the right protective equipment on to protect our staff and other women that we come into contact with. So it's really, really important that you let us know if you have symptoms before you turn up to hospital, because we have ways that we can manage it to keep everybody safe. The other thing that I just wanted to point out was that we are trying our absolute best. We have had some people being quite angry and cross with staff over partners being able to attend for various aspects of care, and you know, please can you bear with us. We are just following our guidance to try and keep you safe as well as everybody else. I was going to give you the analogy of the community midwife. If you see a community midwife, she has contact with you, but that community midwife also has a caseload of about 100 other women. And of course, they will have people that they live with and contact there. So it really isn't just about you and your family, it's about the community midwife and her family, it's about her caseload of women. And this is all about us trying to stop this spread of infection. Everything we do and all the procedures that we put in place are to mitigate against infection. And whilst I appreciate, you know, some people feel quite distressed about partners not being able to come for some of the scans and other aspects of care, it really is important that we try to keep this infection under control. I wanted to add as well, it's really important, especially in the third trimester, for pregnant women to follow the government advice and really do what they can to mitigate against infection. We have seen an increase in infection this time round compared to the first lockdown that we have. So we are seeing more pregnant people with the virus. So please, social distancing is very important. While pregnant women are generally don't seem to be as unwell, they can still spread the virus. And some of you will be aware we've mentioned on previous lives, it's very important to tell your community midwife if you have symptoms or testing positive for the virus, because there might be some other aspects of care that we have to do to make sure that you and the baby are well. So please, please, if you test positive or have symptoms, let your community midwife know. So I think I've got some questions already in the chat box. So Hannah, you've asked, can your partner attend your 36-week scan? Hannah, unfortunately, partners can't attend that. We are saying, in terms of partners, for partners to attend your 12-week scan and your 20-week scan at present, but no other appointments. And for you just to attend for your midwife appointments without your partner as well. This is very, very important. I did a live on this, I think it was about the 15th of January. So you can, I've gone through different scenarios then, and you can look back over that. But we're really sorry at this point, then no partners can't attend. And can I just clarify, over the weekend we had problems with people being upset about partners not coming for induction. Again, it's about being very clear. I'm afraid it's only in, we have a few exceptional circumstances where people are, you know, for example, somebody that's under the age of 18, and some other people where we are trying to enable their partners to be present. But for the majority of women, partners cannot attend for the stages of induction of labour, but absolutely can attend when the person who's being induced goes into labour. She may go to the spire, she may go to delivery suite. That's at the point partners can attend. So I hope that helps to clarify that. Jennifer, you've said you're 36 weeks today and you've your routine 36-week scan tomorrow. Your midwife's pretty certain baby's a breech. Will my partner be able to come to the breech clinic with me? Yes, Jennifer, we have single rooms for the breech clinic, which makes it much easier. And obviously we have cleaning staff to hand to be able to help us ensure that the room is cleaned thoroughly afterwards. So yes, your partner can attend the breech clinic with you, because obviously we're making decisions with you about next steps for the birth of your baby. Hannah, you've asked, is it at the John Radcliffe Hospital maternity? So Hannah, some of the scans are at the John Radcliffe and in the maternity department, and some of them at the Horton in Banbury. So follow the instructions that's on your letter as to where your scan is. Charlotte, you said you had a phone call today to say I have to attend mine alone on Wednesday. Charlotte, yes, I am sorry that you're having to attend the 36-week scan alone, but like I said, we're just trying to keep everybody as safe as possible. So people are responding for me, thank you. Louise, your placenta is low lying, and it's at the front at your 20-week scan. If it hasn't moved by 36 weeks, what will the next step be? So Louise will go into detail with that. For some people, the placenta may be low, but there is distance from the cervix, which means that if the cervix was to open in labour, then it wouldn't be a problem. But for some people, the placenta sits very close to the cervix or on top of the cervix, which means that it is more difficult when you're in labour. Please note that the majority of placentas that are found to be low-lying at 20 weeks aren't low-lying by the time you get to 36 weeks, but we will obviously counsel you then about what the next steps are. Charlotte, you have said you were just wondering if your 36-week scan shows your placenta hasn't moved and you need a caesarean section. Are you able to request a gentle caesarean section? Charlotte, our caesarean sections are carried out with most of the principles of what is a gentle caesarean section. For those of you who are not sure, it means the really important things are we put the electrodes that would monitor your heart, we put them on your back so that your chest is clear, so that after your baby's born, you can have skin-to-skin contact. We, when baby is being born, we drop the drapes for people that want to see, so that you can see your baby being born, and it's a slower process as baby is born. We do delayed cord clamping in the majority of cases, and obviously then your baby will go to you. So we try to keep it as positive an experience as possible for you, and our aim is to have baby with you. But that we'll go through that in more detail with you when you come for your preoperative appointment. Lucy, you're saying, if you have a caesarean section planned or emergency, when would the 2-hour visiting limit for partners begin from? Would it be from the baby is born and from when you're out of surgery? So generally, Lucy, it's when you have a planned caesarean section, women stay in the observation area for a couple of hours before they go upstairs. So it obviously starts from when you come out of theatre, because that's when we're doing the observations on you. And generally it's the same from an emergency perspective, because we're keeping an eye on you for a couple of hours after the birth. But occasionally, depending on which area you go into after your caesarean section, if there's a lot of people coming in and out, we may have to adjust that timescale. But we try to ensure that there's a couple of hours after the birth where possible. Lucy, thank you for being encouraging that it's not so bad being on your own. Hannah, you had your 36-week scan. You have it in a couple of weeks and you're happy to attend alone. You're more worried about other women and their partners in the waiting room and your exposure to them. Is it possible to wait outside and be called when the sonographer is ready? So Hannah, please don't be concerned. There aren't, for the majority of people, there aren't partners in the waiting room, and we have mapped it all out. We've done a risk assessment to make sure that you can socially distance. What we don't want to do is delay you coming in for your scan, because then there's the potential that we won't get through all the scans that day. So for us, we absolutely are trying to mitigate that risk for you, and we've done our risk assessments. So please don't be concerned about it. Victoria, thank you for being encouraging and saying how safe you felt in the waiting room. So Yasmin, you say it looks like your baby's growing a bit smaller. You're 32 weeks and worrying and stressed. Have a follow-up appointment next week. Any advice welcome, please, as feel scared and lost. It's hard going through this without my partner. And does this mean your partner won't be able to come when you induce you to? So Yasmin, I'm sorry to hear that you have PTSD from your last pregnancy. Please be reassured that the staff, when you meet them, will be friendly and supportive. We're absolutely doing everything we can to make people who are separated from their partner at that time, to help to make them more comfortable with what's happening. And when we induce you, again, the induction team, I hope you can still see the film that's saved on the Maternity Voices Facebook page about induction, but you will meet generally one of 2 midwives, and they will be there to help to make it as positive an experience as possible until your partner comes. And the induction bay is very quiet at the minute, the way we've restructured it, so that you have lots of time and support from the staff when you go there. So thank you all for supporting each other. We are overwhelmed how much people are supporting each other and helping to reassure them. There have been some lovely posts on the Maternity Voices Facebook page this week with people explaining what it's been like to have a baby at these times. So hopefully you can read those and that will help with some of the anxiety that you're feeling just now. So Caitlin, when coming into hospital in labour, are partners being tested as well? So partners aren't being tested just now. We're going on testing women. And you're asking what happens if the test is positive for aftercare on the wards, etc. So, Caitlin, thank you very much for bringing up the question in testing. It's really important. We are testing all women now when they're in labour. So, if you're planning to birth at home, in a midwifery-led unit, in the community, in the spires, and on delivery suite. And it's really important for us to have that information, because in some, the general advice on women who have COVID-19, you may be symptomatic, you may be asymptomatic, but it is about us. There is some additional monitoring that we need to do when you're in labour, so it's really important for us to know that. So, if you are planning to birth in a midwifery-led unit, for example, we've got Wantage, Wallingford, Cotswold Maternity Unit and the Horton and Banbury, you would have what we call a lateral flow test when you are in labour, and if that lateral flow test is positive, we strongly recommend that you come into the delivery suite to have your baby, because we need to keep an eye on your oxygen levels, and we need to keep a closer eye on baby's heart rate. And also it's about how we keep everybody safe and reduce that chance of infection. So for women who are positive, if they stay, some women who are positive after they've had the baby go home. Other women stay overnight in hospital, and we do have specific bays. We have a bay for more high-risk women in our observation area, and we have rooms for women that aren't as high risk obstetrically on level 7. And we all wear protective equipment to make sure that we're reducing the risk of infection. I wasn't sure if anybody wanted to see what we use for a lateral flow test. It actually looks bigger on camera, but it's actually a very, very fine. It's finer than the cotton bud that you may have, that you buy in shops. And that just goes into your nose, both sides, and then we do the test on it. But we don't do it obviously when you're having a contraction. We do it in between, and we get the result in about 30 minutes. During that time, obviously, we'll be taking care, and then we have certain cleaning procedures we need to follow if that test is positive afterwards. So I hope that's answered that question. That's just my husband walking past. Jo, you've asked, are partners still able to attend scan appointments at the twins clinic? Jo, for certain scans via the fetal medicine unit, people are able to attend some of those appointments, but we can't guarantee it will be all of them. So again, it's similar to people who just have one baby. It's for the key scans where decisions are required about the care of your baby. So Alice, you're 38 weeks pregnant. How often should you see your midwife? You last saw her at 36 weeks and the next appointment is booked at 40 weeks. It's your first baby and you've been told she's a bit bigger, so we'd like to get labour moving as soon as possible. So Alice, when you see your midwife at 40 weeks, she will offer you a stretch and sweep, which can help to get things going. Other than that, we advise you to be active. So balance rest with activity, but try to go out for walks. And you can do some hand expressing if you're planning to breastfeed, which gets your natural oxytocins going. But if you have any, if you have any concerns, please contact your midwife. But generally, labour will happen, at any point from now on in, and things can change quite differently from how you are now. But hand expressing is really good for getting that natural oxytocin going. Sophie, you've asked, do you get a phone call before your scan to say whether they can come or not? Yes, Sophie, they are phoning people before scans to go through the COVID questions with you, and at that point they will tell you whether partners can come or not. But generally with people, I can't remember, Sophie, if you were the lady who had twins, if it's a head down baby, generally it's just 12 weeks and 20 weeks for that. Emily, you're 28 weeks and hoping for a vaginal birth after caesarean. You haven't spoken to anyone other than my midwife. Should you expect to talk to a consultant about it? No, Emily, we have a midwifery-led feedback pathway. So your community midwife can answer any questions you may have about it. We also did a live on the Facebook, and again, that should be in the YouTube collection that are on this Maternity Voices website. But yeah, I mean, if you're planning a birth after caesarean, a vaginal birth, then your midwife should be able to answer all those questions for you, and it's great. It's very positive. The majority of people are successful, so get you home and get you back to normal as soon as possible. Megan, you're 36 weeks and thinking about your birth options, hoping to have your baby at your community hospital. If you do have your baby at the JR or Spires, assuming everything's well, could you be discharged right away, or would be expected to stay in for observation as standard procedure? So Megan, all being well, people will go home as soon as possible. You can go within generally 4 to 6 hours after the birth, because there's a bit of paperwork, etc., that we have to do. It can be different for different people. So Ellie, you're saying, any idea how long partners won't be able to come in with us for scans? You've got a 32-week scan in March. Will the hospital write to me before then to say whether your partner can come? So Ellie, as it stands, we obviously don't know how long this is going to go on for, and as soon as we make any changes, I promise I'll be on here telling you all about it. But yes, they will phone you beforehand to go through again the COVID questions to make sure that you don't have any symptoms before you come into hospital. And again, if you could be honest when they're asking you those questions, because we really don't want people with symptoms coming into the hospital. And we would just rearrange it. So Kezia, you just wanted to say that firstly, oh, thank you. Sorry, I was going to read that out and now I'm embarrassed. Thank you very much for your positivity. It is really great that you can support other people, and I hope people will read those questions to know what we're, that we are providing as safe and as positive a service for you. So Michelle, you said if a woman tests positive in labour, can her partner stay for the birth? So Michelle, yes, your partner would stay with you from the birth, and then they will go home after the birth to isolate. So it is really important. If your partner is obviously symptomatic themselves, then we would ask them not to come and to stay at home and isolate, and you could bring another birth partner with you, but obviously they would have to isolate after the birth for the 10 days. So that may be relevant in who you're bringing with you. Hannah, you've said if we've been told that you can deliver at the Spires, when do we need to contact them? Is there a virtual tour available? Absolutely. We've made a film again with Maternity Voices partnership for you to have a look at. You basically contact the Spires, phone the Spires number when you think you're in labour, and they will advise you when would be the best time to come in. Occasionally the midwives and the Spires can't answer the phone. So if that's the case, you may need to phone the maternity assessment unit. It doesn't mean you can't go to the spires, it's just that at that time they can't answer the phone. We do move staff around depending on where women want to birth their baby, so to enable somebody to be there with you. Yeah, try the spires first, but if they don't answer, the maternity assessment unit will always answer. So Sharna, you're asking when is the best time of day to do perineal massage? Is after a bath, morning, etc. You're 34 weeks. Sharna, I think from a comfort point of view from you, I always find that it's better for women to do it when they before they settle down to sleep at night, because otherwise it can be a little bit uncomfortable in your underwear during the day. So I appreciate that some pregnant women are up during the night passing urine, but before you settle down for the night would be the best time to do it. Tammy, you're coming in on Thursday for the balloon, as you'll be 42 weeks that day. Can you expect to have a COVID test that day, or when you come back Friday to have your waters broken? So I think they're doing the COVID tests on the day. They're doing the COVID test when you come in for the balloon to be put in. The girls will go through that with you when they call you as well, but I think generally that's when they're doing it. And Sarah, you're asking, after caesarean section, how long would you have to stay in hospital? So Sarah, it's as a minimum, it's 1 night, but it can be a couple of nights. It depends how you are, how you recover, how your baby's feeding. But if you have a caesarean section, say on Monday morning, we'd be hoping that you would be able to go home Tuesday evening, obviously if the caesarean's in the afternoon, you may have to stay in 2 nights and go home the following morning. But we appreciate that people are trying to go home as soon as possible, and we've got lots of resources in place to try and enable that to happen. Ella Rose, you're 19 and this will be your first baby. You're classified so far as having a low-risk pregnancy and really looking forward to going to Wallingford. I think, Ella Rose, it's a great place to be. Our midwifery-led units are fantastic. So if you are a low-risk woman, we would absolutely be recommending that you birth your baby at home or in one of our community midwifery-led units. But obviously, if you have any risk factors, the midwifery-led unit might not be the right place for you. Again, we've got some information on Oxford University Hospitals and the maternity pages in the website on home birth and birth and midwifery-led units. And there have been lots of lives recorded via this Facebook page as well, with more information, and obviously ask your midwife if you're unsure. But hopefully it'll be a very positive experience for you. Emily, you're 32 weeks, and just found out your baby is transverse. When does that become an issue, and is there anything I can do to encourage her head down? So Emily, you can have a look on websites. There's all sorts of different positions and things, but generally it's not a problem until you get to 36, 37 weeks. So babies have a lot of space and can move about, and so baby will settle down eventually. But some people like to try alternative positions, etc., and you can search away on the internet for those, but generally baby will sort itself out. And then I think, Sam, you've just obviously provided some information to Sarah about when you had your baby. So today was a chance obviously to answer your questions. These lives all get saved so that you can watch them back. And so I think my key things to people are, if you're offered a COVID test, please accept it. We want to be able to have the right people giving birth in the right place. And we want to be able to identify people that perhaps need a bit more screening. And we do, again, really encourage people to follow the social distancing, make sure that your partners do as well. We really want to see a reduction in this virus. And, you know, when you're thinking about whether to have the test or not, please think of the implications, not just for you and your family, but the midwife and their family, and the other people that they are in contact with. So we absolutely ask you, if you will please have the tests when we get to that point when you're in labour. And I think I've answered most of the questions. Sarah, I think you said you're 38 weeks pregnant and planning a home birth. Your midwife told you if you need to come to hospital, there could be a long delay due to the shortages of ambulances. Is this still the case? So, Sarah, we have regular communication with South Central Ambulance Service, and we are not. It is safe for us to still continue to offer births in community units and home births. If there became a chance when that wasn't the case, if the ambulance couldn't respond promptly, we wouldn't be offering that service. So at present, we are still offering that service. So please be reassured that if we need an ambulance, we are feeling confident that we can have one. And Sam, you're saying how far back do the COVID tests go? So the COVID tests are testing to see if you have the virus at present. I'm not sure if that was what you were asking. You know, we repeat our COVID tests ourselves. So all staff, we do these lateral flow tests twice a week to make sure that we don't have anything when we're coming into work. So, you know, if you had a COVID test and it was negative and you come into hospital 2 or 3 days later, we would still repeat the COVID test. So I'm hoping that covers the extent of your question, Samantha. Ellie, you said you feel some movement from your baby every day, but not at regular times. Should you be worried, or is this normal? So Ellie, babies move. Your baby will be getting into a normal routine over the next week or so, and you will find that the baby doesn't move all the time during the day. Some people have a very quiet morning and then baby moves in the afternoon or evening, and you'll just become more and more aware of what your pattern is. And if you have any concerns, please do ask a midwife. Jessica, you're 23 weeks pregnant and tested positive for coronavirus last week. Your symptoms were mild and you're feeling better. Because your symptoms weren't too bad, it didn't occur to me to contact my midwife. Should I do this now or wait to mention it to your doctor at your 25-week appointment? No, Jessica, please can you call your midwife and let her know. She needs to record that, and she will tell you whether there's further tests or anything that you need. So yes, please do contact your midwife rather than wait. So sorry, Samantha, it was about how far down your nostrils. So we just go to the back of your nose. We're going in about 1 centimetre, and we go into both nostrils. Emily, you had a COVID test the other day. It's really not that bad. It makes you sneeze, but it doesn't hurt. It can sometimes make your eyes water a little bit. We go for the PCR test that we use in hospital goes in your throat and in your nose. The lateral flow test that we'll be using at home and in midwifery-led units just goes into your nose. Kate, sorry, this is your second baby, and you're having some issues with your back that have been going on since your first. You had physio. Do I need to go via? Oh, I think you had physio with your first pregnancy. And do you need to go via your GP or midwife for referral? Generally, yes. They will reopen your case, but if you can go via your GP or midwife. So thank you for answering the questions on the swab. So I think that's all your questions answered today. I want to thank you very much for being part of this. Apologies for my hesitancy today, but being at home doing this on my day off, doorbells are ringing and my partner's about and there's all sorts of noise going on. So I'm very sorry if I appeared a little distracted today. So I wish you all well. Please stay safe. I have another Facebook Live planned in 2 weeks' time. Please remember we have our infant feeding team every Thursday afternoon at 2:30. So thank you again and take care, everyone.